Texas faces a severe shortage of primary care providers, a problem that stretches from our rural areas to our major urban centers. The Texas legislature is currently considering a dramatic plan to address this shortage by providing financial incentives for those willing to serve in medically underserved areas. Healthcare providers, patient advocates, community health centers, and elected officials have been rallying behind this historic legislation. House Bill 1876 has a unique blend of support that crosses the rural-urban divide and is uniting healthcare advocates, the business community, and medical providers.
State Representatives Warren Chisholm and Richard Raymond co-authored House Bill 1876. It creates the Texas Healthcare Access Fund, which they say will increase the number of doctors practicing in underserved areas.
Now, two state lawmakers from that region have proposed legislation to try to make up the financial difference to doctors who commit to serve in high-need areas. Rita Culpepper from our Austin station has details. Good afternoon.
Hi there, and health experts tell us that the number of med students going into the primary care field is down due to the amount of student loan debt they'll face. And that means many clinics are having trouble recruiting doctors.
Leaders gathered this morning to address a growing problem in the Brazos Valley, a doctor shortage. On today's agenda, House Bill 1876. The legislation would help pay off student loans for health care providers who agree to work in underserved areas of the state.
Providers and some of their patients are speaking out today about a shortage of doctors in the Houston area. They will ask state legislators to pass a bill that would establish the Texas Healthcare Access Fund. It would help doctors and other healthcare providers pay off student loans, and in return, they would have to make a 4-year commitment to practice in underserved areas.
Right now, many East Texas counties need additional doctors and physicians' assistants at community health clinics. East Texas News' Donna McCullum tells us why they need the help and how a bipartisan plan is addressing the statewide healthcare shortage.
The lobby of a community health clinic is full. Behind the doors are healthcare providers, but not enough.
We need this. We need this hook, for want of a better term, to be able to get people to come to our centers and to come serve folks in health professional shortage areas.
We're here to just say that the city supports this bill, HB 1876, and any bill that will promote increasing primary care providers in our Houston clinics. We know there's a shortfall, and we're here to say that we support any bill that will do this.
Right now, it takes 2 to 3 months to take on a new patient, and the problem isn't money. It's a shortage of primary care physicians. Now today, this clinic and others in the area got behind proposed state legislation that would create an incentive for medical students to become primary care physicians. It's House Bill 1876, the Texas Healthcare Access Fund.
Another equally shocking statistic is that nearly half the counties in the state of Texas do not meet the standard of having at least one physician for every 3,500 people. Now today, a show of support was held at the clinic known as Su Clínica Familiar in Harlingen for House Bill 1876. Now the bill creates a fund that works kind of like a scholarship for work for new doctors.
Experts say something needs to be done to fix a critical shortage of doctors. They used a Heights area clinic to push a bill now in the Texas House that would help establish a healthcare access fund to address the problem. Doctors say the Houston area has been severely impacted by the shortage of physicians, nurse practitioners, and dentists.
State lawmakers are also working on a bill that would help medical professionals pay off student loans. Laura Neal has a story.
We've been challenged for years to get providers in our medically underserved areas.
Central Texas health officials say they need doctors in rural areas, but those doctors have big college loans to pay off. The bill would help physicians pay off student loans in return for practicing in an underserved area for 4 years. Currently, the Sun City needs dentists, family practice doctors, and pediatricians.
As a clinic director, I often speak to recent graduates of medical school and dental schools, and they tell me that they have an interest in serving communities of low income. But because of their educational loans, they find it necessary to pursue other opportunities that are more lucrative because they have this financial debt that they have to manage. If it were not for that debt, they would gladly join our staff and serve in these communities. And so this bill will provide a loan repayment program which will enable physicians, dentists, and social workers to serve in these communities where there is the greatest need.
Así es, se trata de la propuesta de ley 1876 presentada por el representante estatal Warren Chisholm, y Mónica Navarro nos acompaña con todos los detalles.
Gracias, Jorge y Brenda. Esta propuesta de ley 1876 permitiría...
Así es, Osvaldo. De hecho, contar con un médico de cabecera es clave no solamente porque conocerá mejor su historial médico, sino porque, de acuerdo a las últimas estadísticas del sector salud, cada vez menos médicos familiares quieren practicar en Houston y a lo largo del estado.
The legislation would help healthcare providers pay off student loans in exchange for practicing in underserved areas.
But I grapple with the decision as to should I go somewhere where I know I'm going to make more money and I'll be able to pay that, or go where my heart really is.
More than half of the 254 counties in Texas currently need an additional primary care physicians, including Dallas and Tarrant counties. The shortage of doctors has forced some clinics to stop accepting new patients.
Plenty of cheers at Su Clínica Familiar for House Bill 1876. Supporters of the bill say it would bring primary care doctors to the valley.
We have great need. There's a lot of population growth. There's a high rate of uninsured patients in our community, and a lot of patients are going to the emergency rooms and utilizing that as their medical home because they do not have access to a primary care physician.
We're a community that's experiencing a lot of good, solid growth, and our future is going to be dependent upon our ability to provide good health care to the people that decide to move in here in addition to the ones that are already here. We have a critical shortage in both nurses, and particularly nurses, but also with doctors in the country. And I think anything that gives educational opportunities to folks that are pursuing healthcare professional careers is going to be beneficial to us because we're going to need to attract a lot of those folks in for future growth in our community.
We're excited about having the opportunity to support House Bill 1876. We want to make sure that we can do whatever we can and be here for the community. Martin Luther King Family Clinic has been here over 23 years, and we'd like to continue to be here for a long time and expand out to other areas so that folks don't have to come so far to come see us.
Texas is dealing with a shortage of doctors. Today, local health care providers, patients, and community leaders are pressing state lawmakers to pass a bill that would bring doctors to rural communities. Dallas and Tarrant counties are designated as two of the most critical shortage areas. Because of that, many clinics have closed.
First, Texas legislature could bring more doctors to people living in urban and rural areas of Texas. Today in Austin, lawmakers presented House Bill 1876. They say it would create a fund to help medical students pay off their debt if they choose to become primary care physicians in underserved areas of our state. Money for the Texas Healthcare Access Fund would come from a change to the way smokeless tobacco is taxed. It is estimated Texas is in need of 4,500 doctors. Lawmakers say this plan will help encourage more people to become doctors as well.
But a new bill circulating on the Texas House floor would put more doctors in rural hospitals, filling a void that's deepening around West Texas. Sarah Snyder has the story, all new at 6.
If you try to make an appointment here at the Crane Memorial Hospital, chances are you'll have a long wait. They're down to one doctor serving the entire county.
If you live in a rural town with few or no healthcare professionals, you probably run into the problem State Representative Warren Chisholm is trying to fix.
He introduced House Bill 1876 this week to help those in rural areas in our state get the health care that they need and deserve. The bill would pay back student loans for doctors and nurses and other healthcare professionals willing to work their first 4 years out of school in a rural town.
Borderland residents gathered yesterday to address the shortage and to urge lawmakers to pass the Texas Healthcare Access Fund. The bill aims to help medical school graduates pay off their loans if they agree to work in underserved areas such as El Paso County.
It's very critical that this bill be passed so that we can begin to address the issue of declining numbers of primary care providers. And I think that this is going to be an excellent opportunity to reverse the trend.
Pleased to represent HB 1876 to support bringing more primary care physicians into the state and incenting those medical students to really look at this field. As a representative for the Texas Medical Center, she sees this as a critical need, both in the urban core as well as the rural areas in Texas. And so this bill is a wonderful opportunity to bring more people into this particular field and really serve the needs of our state and our residents.
It's estimated Texas is in need of about 4,500 primary care physicians. If a House Bill 1876 becomes law, it would help medical students pay off their debt if they choose to become a primary care physician in an underserved area.
Some say a severe doctor shortage is causing big problems in parts of Texas, and not just in the rural areas. CBS 42's Alexis Patterson joins us live with more from the Capitol with details on a bill that aims to address this shortage. Alexis.
That's right, Judy. Lawmakers here are considering a bill that would give doctors more incentive to become primary care physicians by expanding the programs that help them repay their medical school loans.
Primary care physicians across Texas. Some state lawmakers are hoping to change that. It's estimated Texas is in need of 4,500 primary care physicians. But if House Bill 1876 becomes law, it would help medical students pay off their debts if they chose to become a primary care physician.
Estados en Texas enfrentan una marcada escasez de médicos, enfermeros, practicantes y dentistas. Ante este panorama, proveedores en el cuidado de la salud, administradores de clínicas, pacientes y líderes comunitarios
se unieron officials to pass a bill that doctors say could save lives in the valley. A group of doctors gathered today to highlight the need for health care providers in the valley. Dr. Elena Martin says her clinic has a shortage of 4 positions right now, and it could mean life or death for some patients.
Way to get more doctors and dentists into areas that desperately need them.
The proposal would help healthcare providers pay off their student loans in exchange for their service. Here's NBC5's Christy Nelson.
I'm going to start by listening to your heart, okay, bud?
Dr. Stormy Williams keeps busy at the Martin Luther King Jr. Family Clinic in Dallas.
I was going to do nose.
Okay. Nose! So busy that patients have to wait longer than they should.
It's kind of hard for us to get the patients in as they need to be seen. So as of right now, if a person called to make an appointment with me, because I'm the only pediatrician here, they may have to wait 3 to 4 weeks to get an appointment.
The patients need to call. Our staff needs to call our legislators and make sure that this House bill is passed. It certainly is a great recruitment tool for us to be able to get providers in our facilities and be able to help the uninsured.
House Bill 1876 is really going to be a great, it's going to be a great bill, and we're asking that legislation passes as soon as possible.